I would like to call the meeting forward. Would you take the roll?
Yes, I would love to. Member Riley is absent by prearrangement. Sheriff Bauman.
Here.
Member McGorty.
Present.
Dr. Miller. Here. Auditor Weir.
Here.
Ms. Angela.
Yes.
Chair Barash.
Here.
Member Myrtle.
Here.
Member Liberty is absent by prearrangement. Donna Spaghetti Muscat. Vice Chair. And Member Diamond.
Here.
Can we, so, I guess, it says the expenditure report, but don't we do the approval of minutes first?
No, we're doing the
Okay,
expenditure.
expenditure report, Mr. Weir.
Okay. All right. Thank you.
Wait, do you want to?
I'm sorry, yes, I
public
did
expression
not
first?
call public. So, can we have public expression? Anyone who would like to say something?
It would be appreciated, Carol Hester, if we had a copy of that report from Mr. Weir out here for us.
It's in the binder in the back.
I mean, to have it our seats, not to go to the binder. I mean, before we've always had it in a packet. It's back there, right?
Yep.
Okay, so 16
Did she take
people
the
go
binder
back.
to her seat?
I don't care.
Yeah.
As long as it doesn't leave the room.
Okay.
All right,
Okay, so looking at our revenue and expenses, life to date, the top portion is our revenues, our Measure B sales tax proceeds. We have one more month of receipts. We received in February, on February 26th for $814,006. Is our total running balance for revenues at $6,180,289. There's been no change to our expenditures section next. And then all the way down at the bottom, you can see a summary of the life-to-date revenues, the life-to-date expense, and any interest earnings right now are $15,943. So our current balance is $5,997,185. And I do have some news for, I think Mr. Diamond mentioned this last meeting, on the reason that you see some of the higher monthly amounts. And the CEO in the auditor's office met with our sales tax consultant, and apparently what's going on here is the state had started transition to a new computer system first quarter. And of course, with new systems, so the first quarter was short, the second quarter was short, and then during the third quarter, they made up for those 2 quarters, and that's why you're seeing the higher amounts in those months. You should eventually see things smooth out. Thanks, appreciate that. You bet.
So I have a question.
yes.
At one point, I think we asked if you'd be able to break down where the funds came from, if there was some way of tracking how much of it came from the coast.
Oh, yeah, and that's gonna have to be an additional request of our consultants. That's gonna cost us some money and I'm not
The
sure we
state
want.
can't provide that.
Yeah, they don't give it to us. Our consultant would have to go in and specifically pull out those, parcels and areas and do their own. So the state doesn't break it down that way, coast versus inland. So just like that.
Thank you.
You bet.
So that's my report. Okay, thank you very much. So next is my report from discussions. Approval of minutes, okay.
And I'd like to just announce that the minutes that you received previously to the meeting have been corrected, and the minutes in your packet are correct.
Oh.
And I, having read the corrected minutes, move that we accept them.
Alderman second.
All in favor?
I had a question. In the original ones, I haven't read the corrected ones, but under the item, the committee discussed possibility of having new committee members
Yes,
working
that's
with.
been corrected.
That's been corrected, so I thought you took my name off volunteering.
Corrected.
Okay, maybe sometime, but I can't right now, thanks.
You're welcome.
Okay, thanks, Rhonda, you caught that too, I guess.
Okay. All right, all in favor?
Aye.
Aye.
Any opposed? Okay. That passes. And, discussion and possible action regarding the report from the chair regarding direction provided by the Board of Supervisors. So on March 12th, I met with the Board of Supervisors and requested a project manager for the construction that we've already decided on, and they approved the project manager, and now it's a question of opening it up to applications and deciding who will serve. And then Jan McGordy talked to the Board of Supervisors also and recommended that we as a committee study the Kemper report and prioritize further services as recommended by the Kemper report. And the Board of Supervisors also encouraged us to review the Kemper report. On a discussion with Jan McGordy, it was decided to appoint a subcommittee to.
No, there's been no open discussion.
Oh, okay.
It's an app.
Yeah, it's here for an action now.
Okay, I see. Okay, that's the end of my report.
So if you wanted to request that there be an ad hoc, this would be the time.
Or when we actually get to the item.
Yeah,
which is
yeah,
the
exactly.
item,
Perfect.
We should go
Yes.
on to 3D.
Yes.
So 3D discussion, possible action regarding current provision of county data.
When we get
Yes.
No,
No,
Jane's item.
3D.
So passing around, and there are some also in the back for anybody who would like to grab them. There was a request to provide another look at especially mental health services that are provided through the county. As a reminder, the county is contracted with Medi-Cal, which carves out specialty mental health services. So we only provide specialty mental health services to those individuals that have Medi-Cal and meet the specific mental illness medical necessity criteria. So I went ahead and put together a list of those again for you guys. It details out what are the specialty mental health services that are covered and paid for by Medi-Cal. You'll also note that there's a couple little like stars under there that remind us that certain facilities like boarding cares have the IMD exclusion, which means that if they have more than 16 beds, if you are not over 65 or over, we cannot get Medi-Cal to reimburse us for those. And for anyone under 21, the IMD exclusion allows us to allow inpatient hospitalizations to be paid for. So a psychiatric inpatient hospitalization can be paid for those that are 21 and under, but not residential care. So that's sort of an explanation of the IMD exclusion. I did go ahead and note those two, so you're really looking at boarding care and psychiatric inpatient hospitalizations, or POP is another term that we constantly use regarding that. I also wanted to detail out just what are the different types of boarding cares. There's multiple levels of boarding cares, and I wanted to make sure that that's kind of detailed out on there. There's the mental health rehab centers, Institute for Mental Disease, adult residential treatment, and then special treatment programs and skilled nursing facilities. And those are skilled nursing facilities that have a designation to treat those who have a mental illness. I then went ahead and detailed out for you guys the services offered within Mendocino County that can be reimbursed by specialty mental health Medi-Cal services, and you'll see those listed. You will note that we have one boarding care within our county that is up in Willits. That is Redwood Creek. It's been there for a couple years. They do, while they are in the county, they are a 60-bed facility. The current operator is not willing to have us bill Medi-Cal through that facility. They are noted as that we do have them in our community. We do use them, but we cannot bill Medi-Cal through that facility at this time. I also noted on there some additional special mental health services that are offered within Mendocino County that consist of our assisted outpatient treatment, our CalWorks, our community correction partnership where we provide mental health services through probation, conservatorships, mobile outreach and prevention services, and then part of the Whole Person Care Project. On the back, it notes the services that we do offer outside of Mendocino County. This is either due to those services not being available or having limited options within the county. And that's really when you're looking at our boarding care, so our adult residential treatment, boarding care on all levels, psychiatric inpatient services. You won't see here crisis stabilization used in crisis residential treatment. We don't have those in county, but the reason they're not listed is it's not something most counties will take another county's client. That's why it's not listed here as something we go out of county for, because it's not a normal thing where counties will take another county's client into their CSU or CRT. So we couldn't call and ask to have a client placed in one of those facilities easily. I then went ahead and just noted really quickly some of the other non-special mental health services. How do people that don't have Medi-Cal and don't meet the criteria for special mental health services, what are the options for them? The options within Mendocino County, you have Medi-Cal through Partnership Health Plan of California contracts with Beacon. You have options through private insurance companies, the veteran services, private providers, and the health clinics.
Thank you. So 3E, discussion and possible action regarding including review of the capital report is recommended by the Board of Supervisors. So this is where, as I mentioned earlier, the Board of Supervisors. Yes.
Doctor, it was a presentation,
There's got to be public comment to Julian's.
public comment, and maybe we
Oh, I
can.
see.
Yes.
Okay. All right. Is there any public comment?
Board discussion, committee discussion, I'm sorry.
Yeah, I do.
Yes, please.
So, this is well prepared, thank you. This is just something that will be permanently in my book. Measure B is certainly intended to improve mental health services. And one of the things that I want everybody to know is while the presentation by the mental health director is appreciated, there's many things on here which Measure B, it's my understanding, was not the intent of. So crisis residential and crisis stabilization and psychiatric health facility are the three main purposes of Measure B, and as well as the training. And I don't want our group to be sidetracked by the responsibility, the very important responsibility that the Behavioral Health Advisory Board has, because we're apples and oranges from the advisory board. The advisory board focuses on the mental health services, so to speak. I mean, this is something that they meet and they make a difference. I've been to their meetings, I've seen them make a difference. And to be quite blunt, 75% of our funds are brick and mortar plans for the county to improve the services, a physical service where services can be provided, hence allowing emergency rooms to be emptied out and law enforcement to get back on the street. But you know that I'm going to say that because I say it every meeting. And so I really appreciate this, Doctor. This is very good. But the three parts of this, the crisis residential treatment, the crisis stabilization unit, and the psychiatric inpatient hospitalization, my understanding, are what our focuses should be, unless I'm mistaken. Is it correct? Comments, please?
The training.
The training is, yeah, training isn't on here, but the training is part of Measure B.
Yes, please. Jan.
So my understanding is 75% of the Measure B funds will be spent for facilities, or may be spent for facilities. And then there's 25% that will be used for additional services that supplement, not supplant, current services.
Right, and I'm looking forward to when we see the budget of mental health, of what the budget is and how and I appreciate you saying that, Jan, of where the 25% is going to supplement, specifically not supplant what currently the budget is. So I guess once again, I'm just voicing my frustration. I don't want us to get tangled up in what the Behavioral Health Board does, because they are working closely with the Department of Mental Health to work on the services that Department of Mental Health provides. I just want to get focused on what the intention is, and that's to keep people in our county getting services and improve the mental health quality of life. So, but thank you for the presentation.
So the mental health board is supposed to be looking at the whole mental health system. And as Donna has pointed out before, it's a continuum of care. So if we only look at putting people in a locked facility and ignoring how they got there through the progression of psychotic episodes, then we're really not looking at the overall system. So it's all important. We do need those places to put people in crisis because it's a drain on all of our funding.
And I agree with you wholeheartedly. I don't want us to take the responsibility of the Behavioral Health Board because they have a very important responsibility and they do a very good job of it. But I don't want us to duplicate their services.
You know, I guess I'm not clear on, there's a certain amount of overlap. Certainly the Behavioral Health Board looks at the whole mental health system, but you know, we're supposed to be supplementing services as well. The question is, you're making a distinction, I think, between what services they overlook and the ones that we supplement. So like, for example, in the Kemper report, and I assume that what you're talking about as far as what we do, the services, just considering the services, is what Kemper report recommended. Whereas the Behavioral Health Board are the services they've traditionally looked at previously, most of what, but you know, and I think that at least for this committee, those of us who don't have a thorough grounding in the mental health system as it stands, like for example, day treatment. You know, do we have a day treatment in Mendocino County now? And what he recommended was that we have a day treatment, and said that we don't have one. But I thought Manzanita, and some of this was clarified at lunch, but I think it's a discussion maybe that just to clarify what we're talking about, what we're spending Measure B money on in terms of services. I mean, certainly when we're building facilities, then we have to provide a certain amount for services in those facilities.
And I appreciate that. And you know, if we could just take the rough numbers of 75%, 25%, I think I would be satisfied if we spent 75% of our time at these meetings to talk about the brick and mortar aspect of mental health and 25% about the services. Because we're spending more time talking about services than what, as a sheriff, I truly believe our county needs. And that's the brick and mortar place which was the whole catalyst and the genesis of Measure AG and hence Measure B. Thank you.
Any other comments?
Yeah.
Mark.
Me? Go ahead, I'll wait. Mark's done.
So, I think we as a committee need to decide what we are going to pursue as brick and mortar projects. Nobody really wants to step up and say what we want to do and how we want to do it, but we all are in agreement that we need it. Is that a very fair assumption? I'm not sure where the process in the RFP is at and where that's going. I have ideas on what I would like to see with that RFP. But like Donna mentioned in her letter to the editor, I think that we need to have services, but like Sheriff Allman is, we also have to have the brick and mortar, and I think the brick and mortar, the 25% was also to provide services in the brick and mortar, the new facilities that we are building. That's where I think the 25 to 75% is. So that's my interpretation of it, but I think everyone that sits at this table may have a different interpretation, but that's the way I saw it. And I think we as a committee need to decide what we're going to do and start focusing on that and what priority we're going to do it. And I'd like to see it all. I think we need a CRT, a CSU, and a PUF. And the training facility.
Oh, yes. Yeah, I'm sorry.
Yeah, I'm with, I think what everybody's saying, having worked in mental health for 50 years now, I think we all recognize that you need a continuation of service and a continuum of care if we're going to do the best for the people that we serve. We also know that no matter what we do, we can't do it all, even if we wanted to. So I think what we've done by way of looking at the overall services, and the Kemper report did that, a report of what we already have, I think we need to keep in mind, because whatever we add to it needs to fit well with what we have, and there needs to be ways that people make transitions. I think last time, or maybe time before, we agreed as a body here that we would recommend to the board that the top 3 priorities that we felt and was reflected in the Kemper report were the 3 we've been talking about: the psychiatric hospital, the crisis residential, and the crisis stabilization unit. And so it seems to me the next step then is to get whatever we need to get answered or information we need so that those 3 priorities can be actualized, can be worked on. And I think part of what I'm hearing from the sheriff, and I share some of that frustration, that we keep moving ahead on the things that we've agreed need to happen, and that we have, for my need, a timeline of when that's going to happen, a recognition that every meeting we come to is moving those things along expeditiously, as quickly as we can, knowing that we want to be sure we're making good recommendations to the board. And I think, from what I understood in the previous note of hiring a project manager, that given that we're all busy, we all have jobs, we are all doing a full load of other things in addition to Measure B, that having some help with a project manager hopefully can move things along, and we can have a timeline so that those 3 priorities get put into reality and recommended, and that they happen, and that then we can add into those as we have time, money, and can add to the priorities. But I think we want to see the things that we've agreed on priority actually get completed.
Carl?
Thank you. This is a really good discussion, actually. And I want to say that this committee, I think this committee has more influence than either we think we do or we take on. Because I can tell you, as the person who brings items to the board, that if we just go back to paying Kemper the additional $27,000 that we owed him, that the board was not going to approve paying that $27,000 unless the Measure B committee made that recommendation. So what I'm saying is that we have made really one major recommendation so far, which is to look at stabilization residential and the PUP. And so that went to the board. The board directed that staff look at the feasibility of those 3 services. Now that's a huge order, as we know, in that there are so many options here that, when we're looking at location, we're looking at how we would provide this, if this is together, if this is separate, whatever. If this committee made more decisions and pushed more forward to the board, we probably would move quicker.
I'm ready.
And I say that, and I don't say that lightly, because I know there's 11 of us and these are big decisions. But right now, the process in front of us is looking at the feasibility of these 3 services, and it's obviously we're looking at cost, we're looking at location, we're looking at everything right now, and we haven't started that process yet. So I don't know if this committee wanted to make an additional recommendation to the board and maybe narrow the focus. I think it could push us forward a little more. I also want to say, though, that I fully support what Jan is saying, in that you know, we wanted a Kemper review, we got that Kemper review. There's really good recommendations in there. However, we have got to narrow our focus to get something done. And if we look at the whole Kemper report and all the recommendations, I don't know how far we'll get. So one of the outside discussions that we had, a suggestion that Jan was making, was about forming an ad hoc. There's nothing wrong with Measure B forming an ad hoc to actually look at all the recommendations and possibly bring those recommendations back to this committee and then to the board if needed. But regarding actually getting something done, whether we want to say brick and mortar, or whether we want to say a service, if we narrow our focus and we as an 11-member commission actually come up with a recommendation that's a little bit more specific to the board, it's possible that the board will take that recommendation. You know, I'm going to give an example, right? We're talking about, do we build let's just say the PUF. Do we build the PUF at Howard? Do we build the PUF at Orchard? Do we look at the HHSA Dora Street property, take that, build it there? I mean, there's a lot of different options. But if we as a committee really think that there's one location that is a better location, not only for services, but for costs, and I mean, some of this is really pretty, you know, easy for all of us here to understand, then that could be a recommendation that we move forward, and it could move us a little quicker. So what I'm saying is, long answer here, but, you know, this committee has a lot more influence than I think we're taking. And these recommendations from the Measure B committee, the board seriously looks at. Staff brings something forward, they're bringing us right back to this committee. So it speaks to the influence that this committee has, and if we take it, which is different than behavioral health, but it certainly serves an important purpose with Measure B.
Chad, did you have something?
Yeah, just a clarification, Karma, with what you're saying to us. If I understand, what we've done is we made a recommendation on priorities from the Kemper report that we all agreed on. It got sent to the board. The board approved the priorities, and if I understand right, directed staff to move ahead with that. And what wasn't clear from what you said is what staff is going to do and how we can help that happen. So that if you're saying we need to, or it would move things ahead if we narrowed our focus, and I'm not sure whether you were saying we need to pick one of the three and focus on that one first, and then work some of those questions about where it should be, or how do we move it ahead, I guess, from what you're saying, because I think we know what the priorities are. How do we move the action ahead so that we can decide on specifics of where, how much, and recommend to the board a specific place and process and facility?
I don't want to go off of our process here and the agenda item, and I don't know if we're getting, I'm going to answer your question whether here or afterwards.
Sure,
but I don't know if we're sticking with this agenda item or
Right,
not,
so we were
or if we should move on and answer this question with another agenda item.
That makes
I will
sense.
answer that.
We're talking
Either
about.
way,
Yes.
I just said if
Uh,
we're getting
Support was-
far afield, we can come back, but I think that would help us to know how we can move ahead. It sounds like you have some ideas about how to do that.
Well, so we will, let's see,
Are we on the Kemper report?
we're on the Kemper report. So Jen, did you have something to say about the Kemper report?
Well, first I wanted to comment upon what was said before
Right.
about we had make a recommendation that it be investigated the cost of the different types of facilities, and I thought that's kind of where we were now, and that we really can't make any intelligent decision until we have that information. So my question is, what is the status of that?
Well, that's part of the feasibility study, is that my understanding? And so there's somebody doing this feasibility study?
Not yet.
So is this part of the, and I guess a lot of the questions that many of us have are procedural, just how does this and so we're hiring a project manager, but the project manager doesn't do a feasibility study, but maybe interfaces with somebody who does. Is that well, we can, yeah.
You know,
That's not part
It's
of
not
it.
part of the agenda item, but okay, we got off field, so,
Do you,
so
We're on 3E, right?
So 3E, if I can just pipe in,
Yes.
the Behavioral Health Advisory Board made a presentation to the Board of Supervisors, and in return, the Board of Supervisors then recommended that the Board of Supervisors prioritize the recommendations, review and prioritize recommendations contained in the capital report. And it wasn't a recommendation that they encouraged it. I think that was the word,
Yeah, they encouraged.
encouraged it.
Encourage this board.
Yes. That board encouraged this committee.
Do you remember that?
So, the recommendation was to make an ad hoc committee.
I would recommend that we have an ad hoc committee that can go over this in the Kemp report in detail,
Right,
because there
and then
seems to be
Further make
obstacles doing it
recommendations
here.
to the.
And then prioritize things, but also look at the different sections of the recommendations. There were essentially 3 different recommendations. There was the facilities recommendation, which we're kind of working on. There's services recommendations, but also there was financial and administrative policy recommendations, which wouldn't cost a whole lot of money. We just looked at it and figured out, how to go ahead. So that would be my suggestion, is that we establish an ad hoc committee.
Does that take a vote? Yes, okay, so do we have
We should probably.
We have to
designate-
define what,
Yeah, let's
Yes,
talk about
let's
that,
talk
because
about
it's a
that.
mistaken, I mean, there's some problems with it.
go right ahead. Mark, you're.
All right, so I think we have 3 items up in front of us that we all know we need to do. We can start with we can have the ad hoc committee, but we need to CRT, CSU, unit. We need to move those projects forward somehow. We have a standing RFP that's out there giving direction for the feasibility on that. We need to push that forward. So what I think, I'm not sure what we need to do, but I'm going to go off on a ledge and say what I think we should do with the RFP, and people can say, yes, I don't like that, or yes, I like that, or no, I don't like that. But I think that we need to look for feasibility in Howard. We need to look at feasibility in Orchard, and maybe feasibility in one other county-owned property, to see if we can make all of those things, CRT, CSU, PUF unit, and maybe potentially training facility. One's bare land, one's a remodel or a hospital remodel, one can be an existing building. That's moving forward. That is giving clear direction on what we want, feasibility on what it would take to build these facilities in these areas. That's the way I think it should move forward. That's my personal opinion.
Sheriff Alden?
I agree with that. I think that to have an ad hoc committee who's going to be looking at the financial feasibility of providing service and so forth is well outside the realm of Measure B. Measure B is to provide brick and mortar locations in our county where we're going to be able to provide services. But the Behavioral Health Board and the Board of Supervisors, it's well within their realm of looking at the financial aspect of providing mental health services, working with the Director of Mental Health, and saying this is the right way to go. Otherwise, this committee will never make a decision on a brick and mortar. If we're trying to do everybody else's job, then everybody else is going to be doing our job as well. We have a very specific role in this county to improve the quality of life for mental health victims and patients and families and community members. And right now, that I believe our goal, our focus should be working with the Board of Supervisors on genuine locations where services can be provided. Where 50 years from now, Services are still gonna be provided. It may be a different server, it may be the county, who knows, but we are trying to put our finger into too many other people's pie that has none of our business. That's my opinion. Thank you.
Back to what I think we already agreed on 3 priorities. So my sense, and it's, I think, similar to what Mark is saying, and I think the sheriff as well, is that we start there. We've already identified those priorities. They're the same as the Kemper report recommended, and we all not only approved the Kemper report as a guide for us, but subsequent to that, we recommended these 3 priorities. So I agree that that's where we should start, get those done. And I don't disagree with what Jan's saying. I think there may be other things that the Kemper report may have recommended that may be within the Measure B purview. But I'm not going to know that until we actually get the ones that we know our priority. We know where the facility is going to be. We know where the PUF unit's going to be. We know where the crisis residential. We know what it's going to cost. We know, in other words, we have some more data. Then I think we can then look at the 4th priority or the 5th priority, or whatever the additional priorities are that we may want to consider. But let's start and move ahead with what we've already agreed on, is what I'm feeling, and I think some others feel similarly.
I'm not disagreeing that we need to continue and find out what we need to do the facilities and how much it costs and comparing it. My experience when I met with the Board of Supervisors and gave our annual report from the Behavioral Health Board was, that's very nice. I'm so glad you guys went through the report. We're waiting to hear from what the Measure B committee has to say. So they're gonna take direction from this committee, not that we have. And we spent so much money on the Kemper report. It was so in-depth. I don't see any reason why we shouldn't go through and look at the other pieces to recommend what the Board of Supervisors could do in addition to looking after the brick and mortar that everybody is so concerned about.
Because it's not our job.
But they said it was.
They are not our boss. They are, the Board of Supervisors is not the boss of this Measure B commission. And they can tell us they want us to swim the lake, and I'm not gonna swim the lake.
But we're an advisory board. We can't.
You're right. We're not their boss, and they're not our boss.
Right.
But for them to recommend, to suggest that we have to approve everything in this before they do it, I will tell each 5 of them individually, they are mistaken, because that's not their role. Their role is to run the county as members of the Board of Supervisors. And the Behavioral Health Board carries a lot of weight too. And I apologize if anybody thinks that you don't carry a lot of weight, because you do. I heard the presentation and I didn't hear it received the same way that you heard. But I don't care what the Board of Supervisors tells me I have to do on this. The Measure B, which was passed by the voters, was passed for the purpose of brick and mortar and improving services. It has nothing to do with making sure that Medi-Cal, Medicare is going to fund the Department of Mental Health adequately in what we build. We need services like a genuine, responsible county should have. We need building where we can have those.
So there were other recommendations in there that, for example, a reserve be set aside, or a strategic plan be made. You don't think that's something that our board should be, this committee should be concerned with?
Please don't put words in my mouth, Ms. McGordy. That's not what I said. I'm saying that our primary responsibility is to provide direction and a very good recommendation to the Board of Supervisors for building mental health facilities to improve the quality of life for our patients and citizens. Please don't put words in my mouth, and I won't put words in your mouth.
No, I was just asking.
Well, you did, but thank you.
I was asking a question.
Well, your question was making an assumption, which was a wrong assumption. If I sound frustrated, it's because a lot of people in this room, on this side of the table, or from the podium on up, are not willing to make a decision. And it is time. We are in the 14th meeting of the Measure B, 15th meeting of Measure B, and we can't hang our hat on any decision we've made. I hope we're not proud of where we are.
Mark? So, I think that we should look at services, supported services, but not before CRT, CSU, and PUF unit and training facility. And this is important because what we build with those facilities have to mesh and model this, because we need to get paid by Medi-Cal for what we build. So I think this is vitally important. But I think we need to proceed with the feasibility of building those facilities, which we've already recommended to the board. Do we need to get another motion? Because that's part of the priorities and possible actions of 3E. Do we need to make another motion to move those facilities forward? Do we need to give clearer direction, Carmel, than we did before?
Well, I have my pen up.
Okay,
We'll wait.
okay. That's my 2 bits.
So,
Are we still on 3E? Is that what we're
Yeah.
doing?
Yeah.
We haven't
I'm just
gone
checking, I just want to be sure I'm
yeah,
still in the
so-
same place and you
We have
got
a
it.
motion, I
Yeah,
think.
we have a motion regarding discussion possible, that was 3E, right?
Wait, there was a motion?
Well,
No, that's a motion.
Somebody would have to make the motion.
Yeah, I was like,
Okay, all right, sorry.
I'll move that we have an ad hoc committee to study the Kemper report.
Okay, is there a second?
Should I,
Yes, yes.
Can I amend that motion? Is I the maker of the motion?
you can make it.
No, I'm not gonna make the motion, but I'd like to amend it if you would be willing. I guess, do I have to second it to amend it?
No, you can amend before you second.
I think that if we say to, a motion to form an ad hoc to review the Kemper report, recommendations, but have something in there where this ad hoc will not in any way, where the time for this ad hoc will not usurp the original recommendation of the Measure B committee to move forward with the feasibility study for the stabilization residential and PUF. So that might make it a little bit more amenable. Because what we don't want is to form an ad hoc that's going to slow us down even more so on getting anything done.
Can I ask the maker of the motion if they would like to amend it to include who should be appointed to the ad hoc? Would you like to amend to include who should be appointed to the ad hoc committee?
Yes. Do you want me to read that?
Just tell which members you'd like to have included in your motion, which members would be included on the ad hoc committee.
Oh. To include, you want me to name the ad hoc?
Yes.
Okay, so that would be myself and Jim Diamond and Janine Miller
And Tammy Moss, right?
She would be,
she would be.
she's not
She's
on,
not a member.
she's not on it.
No, Donna,
What?
for Ace, one of you.
You know, I think that people who are sophisticated in mental health services and being able to judge what is offered already in the county and what we need would be the best. I think that people involved in mental health services would be best on the ad hoc committee.
Is that a yes or no?
No, yeah,
Fine, whatever.
yes.
Donna, okay.
All right.
There's pens on that side.
Is
Just
there
in
a
case you
second?
didn't see that.
There's a, is there
Jen, go
a,
ahead.
Oh, we need a second to move forward.
Oh, that's right, for discussion, you're right. Is there a
I'll
second?
second it.
Okay. Jen?
Yeah, for me, I think I was clear, at least where I am. I wouldn't want to be on an ad hoc committee now until we move ahead, because I'm not sure what I would be wanting to add until I know where the other facilities that we've already agreed on are. So I would be willing to be on an ad hoc committee after we've done that, if it was still needed, but not now.
But there's other things to look at besides the services.
Say it again?
There's other things to look at besides just services. I mean, we know the facilities are out in front, but there's other things in the Kemper report that have to do with administrative and things like that that really need to be addressed.
Well, I agree. I've, as you know, I've read the Kemp report now 6 times or 7 times. And I agree, but that isn't, for me, the next priority.
In January, I asked everybody at the commission when we had all the people here, making sure everybody had read the Kemp report, everybody acknowledged they had. They have a motion that we're going to study the Kemp report. I certainly will find myself voting against the vast majority because it appears it's going to pass. But to the people who are going to vote for this, I would encourage you to think about how you're delaying the action on getting brick and mortar. Because it would be great to have an ad hoc committee to talk about where the buildings are going to go and how we're going to work with the communities and the city of Willits if that's where it's going, city of Ukiah if that's where it's going, and so forth. But to continue to study the Kemp report for services is well beyond the responsibility of Measure B. But I'm prepared to be the only naysayer in this room.
Mark? What is your purpose of having the ad hoc committee besides putting services before the brick and mortar?
It's not to put services before the brick and mortar.
Then what would be the purpose?
It would be to look at the policies. There was a, specific action plan that we haven't looked at.
I think we are following the Kemper report with a specific action plan because they said vitally that we needed to get a CRT CSU immediately. And we had something in place. And we're really not following the Kemper report by not doing that.
I don't see how this would impede it.
Well, what the reason I'm saying that is that what would you bring to the board that doesn't support what I feel is the brick and mortar? What would you bring with the ad hoc committee?
So we would review the administrative policies that were recommended. For example, we haven't talked about a prudent reserve. We now have almost $6 million, but it could go tomorrow if we start spending it on facilities. And there needs to be a long-range plan so that, we get one chance to do this right. We could blow it in, a heartbeat if we aren't studying it. And I disagree with people who say that we haven't made any progress, because we have made a lot of progress. We got this extensive report. We've made recommendation to the Board of Supervisors to get more information on the brick and mortar that we're talking about. We've made a recommendation to hire a project manager to help oversee all of this stuff. So, these things take time. If we do it tomorrow, without thinking about it, that this is so expensive and so important, our chances of messing up are quite high.
I think my time might be up.
Public comment?
Yeah, Joe Bradley, and I'm just a concerned citizen with that sunroom running loose on the streets. And I've been intimately involved with all of this, dealing with Tom and what we have here. And I'm sitting here with the same frustration that Tom has. You guys bought a report, and I've read part of it, and I get so far and then I've got to stop, and then I'm going to go back to it. And I think an ad hoc committee for that at some point would be good. But right now, I've sat on a board for this county for 18 years. And I've seen how they work and how ad hoc committees work. And I really think you guys need an ad hoc committee now to go look at the properties that you're interested in and seeing if they work. And get your project manager and hopefully have that person be going with you and start putting time and energy into that. I agree with Tom. that's why I voted for Measure B. We can have all the services in the world, and they are all over this county, and they're not consistent. Tom's hands are tied. He's got somebody at the jail right now who is waiting for a bed in a hospital. She's been in solitary for 3 months. She's schizophrenic. She's breaking down because of the situation. My son was there for 2.5 months. And again, they have the right not to take their medication, so they get nothing. And for 2.5 months, they're looking at walls and get to go out in the middle of the night. They can't do anything with the people in the jail because they are disruptive. So what we're doing here, and I'm frustrated like Tom, we need the facility to address these things, to take it out of the jails, to take it off the streets, to get a central unit that will then help all of the ancillary ones. And so I think your ad hoc committee needs to be, go start looking at the properties you're talking about. If they don't look like they might work, fine. If you need to get in a consultant, fine. Give yourself an allotment of money for if you need to get a consultant. I mean, I sat on the Mendocino County Tourism Commission, and we've had to learn how to budget. And I think maybe that's where I'm frustrated too, because you guys are new at this, and it's hard. But focus on what you're supposed to get, then do an ad hoc on the Kemper report, because the Kemper report's going to give you some direction, but there's no point in getting direction if you don't have anywhere to put it. And we need it now. We needed it years ago. So that's my opinion.
Thank you.
So we have a motion and a second. Is there any other discussion? And just a reminder that Carmel said that this would not delay.
Maybe the clerk should read the motion.
Right.
On motion by Member McGorty, second by Member Miller, to form an ad hoc committee consisting of Ms. McGorty, Mr. Diamond, Dr. Miller, and Ms. Musette, and Donna, to review the Kemper report recommendations. The ad hoc committee will not usurp the original recommendations of the Measure B committee to move forward with feasibility study regarding the original recommendations to the Board of Supervisors. Is that accurate?
You know, I think that this is really that, you know, I don't know, there's a lot of time going into this one item and a lot of effort to try to make it sound right. But I think the bottom line is that Kemper report was a good report. We have good recommendations, and the Behavioral Health Board did go through each recommendation and make their own recommendations, and that did go to the Board of Supervisors. So why would this come back to Measure B? It will come back to Measure B to determine if any of those recommendations could be paid for by Measure B. And when you think about what we're doing right now with stabilization, residential, and a 24-hour cuff, and MOPS, you know, the training center is separate because that's already embedded in the initiative, we're going to be lucky to have enough money to do everything that we've already talked about. So, you know, my challenge on this one, because I would like to support Jan because I know what she's trying to do, but my challenge is that I wouldn't want to give any false impression that we're going to review recommendations and come back with additional recommendations to the board to fund additional services from the Kemper report. We are going to be lucky to have enough money to do what we're talking about right now. And so I don't know how that fits in. I mean, I almost think about making an alternate recommendation, which would be to recommend to the board that they support the Behavioral Health Advisory Board in their recommendations regarding the Kemper report. Because it would seem to me that is what the Measure B committee should be doing. So I just want to throw that out there, and I'm not actually making an alternate motion, but I think that, you know, as the Measure B committee, that maybe that is what we should be doing, is recommending to the board that we support the Behavioral Health Advisory Board in their efforts to move those recommendations forward to the Board of Supervisors. Jim?
We could exclude any, look at services at this time in the ad hoc committee. What I'm concerned about is the policies, the strategic plan, the action plan that hasn't been considered. So setting up a prudent reserve so that we have something to fall back on if everything fails, to me seems like good business, but we haven't talked about it, and they won't do it unless we recommend it. That's the kind of thing that I want to look at.
Thank you. I appreciate what a great recommendation. Setting up a prudent reserve is something that we should do. The county's going through horrendous financial messes right now, just dealing with the roof of this building, which replacing the roof of this building is over $2 million. And that's something we should all be concerned about. And so now we're talking brick and mortar stuff, to talk about a prudent reserve and understanding that our auditor controller obviously keeps track of 25-75% of what, in the future, the reserve will be used for maintenance of the buildings and so forth. And I just challenge everybody here to understand, if we're talking about a motion to review the Kemp report for something as simple as putting a prudent reserve in, maybe the motion could be amended to where we can talk about policies and procedures and so forth. But to put an ad hoc committee for the Kemp report services ahead of an ad hoc committee to look at buildings, in my opinion, is not what the voters intended. But thank you. That was a great recommendation for the prudent reserve. Thank you.
I don't know, we can talk about a prudent reserve until we know what the stuff costs to begin with. So how do you determine what a prudent reserve is if we don't know what the funding or what the actual brick and mortar costs? That's where I'm thinking the ad hoc committee is premature.
So I would want to revise the motion to exclude any study of services at this time in the Kemper report. And since we're already moving forward on facilities, that would be part of the scope either.
So seconder approve of that? So the amendment was the review would exclude study of any services at this time?
It would exclude study and services at this time, yes.
Time for a vote.
And the maker of the second said
Yes,
yes?
it was
Janine
She said,
seconded.
okay, all right.
Yep.
I made an alternate.
Do you want to hear, do you want to hear the motion one more time?
Yes, please, thanks.
All right, so the motion was by Member McGordy, seconded by Dr. Miller, to form an ad hoc committee consisting of members McGordy, Diamond, Miller, and Moschetti. Moschetti. Miss Donna. To review the Kemper report recommendations. The ad hoc committee will not usurp the original recommendation of the Measure B committee to move forward with feasibility study of original recommendation to the board, and the review shall exclude study of services at this time.
We're there.
Okay. All in favor?
Aye.
Opposed?
All right, motion carries.
Wait, no.
I'm sorry, motion.
No.
Member Myrtle.
All right.
Myrtle is a no.
Motion carries with Member Myrtle abstaining.
Abstaining or voted
He
no?
didn't abstain.
I'm sorry, but,
He voted
No.
no.
yes. Yes on the no.
Yes on the no.
It's on it now.
Can we move on to?
Yes, let's move on. So 3F, discussion and possible action regarding update on project management support for the committee.
All right. Okay, that one is mine, thank you very much.
Yes.
So the committee made a recommendation in February. On March 12th, the board unanimously approved the adoption of the classification of administrative project manager, and my human resources director is available if this committee has any more questions. This position is posted. What we did is we did a couple things. One is we have a job description that's attached here, And this position is posted for recruitment, open until April 9th. Our small group, which is not an ad hoc, but an advisory to staff, I did have them look at the job description and also meet with a person who I thought could fill this role. However, I think that in the interest of being totally transparent to the public, this position is a competitive process. It's posted for no less than 14 days. The county processes, once the applications come in, they're screened. We can schedule interviews about the same time, and then I would like to have the same small group that volunteered to help administration, that they will be part of the interview panel, and we'll move forward. This again is a project manager. You can see what the job description is. This is not a construction manager, not an architect and engineer. This is someone who can keep us on time, on budget, someone who can handle a software package for project management that will be public, that everybody could see where we are. My hope is regarding the RFP for feasibility of these 3 services, location, cost, all of that we can have an RFP out within a reasonable period of time, and I can't give you a time frame right now. And so that's where we are in the process.
Is there an approximation of the cost this will be, including weighted benefits, so if
Yeah,
it's going to be a county
it's on
employee?
the job description.
Well, I have
And
to
if
be
it's,
determined.
no, if it's not, then, I can have, I would tell you that it's somewhere between, I thought we had it on here, but it's somewhere between 66 and 80,000 plus benefits. So the position is under $100,000 a year and plus benefits.
Yes.
So if we say it's 66,000, we're talking probably with benefits about 110,000.
And they would be at every meeting that we have here.
What they would do is, they would be the person who's actually doing the work, and yes, they would be at this meeting, they would report out to the Measure B committee. They would be, at this point, this is a county employee position, because we thought we could move quicker with that. If somebody shows up that would be the perfect person and would be on a contract rather than a county position, we can do that as well. But, so we're keeping it open because we're looking for that right person. So that's the dollar amount on this position, and it is posted. You can go online and see it. And if you know anybody, please have them go to the county website and apply. And again, you don't have to be a contractor, an engineer, an architect. This is the person who is going to collect the data, follow up and make sure everything gets done. And there are people like that. I have some that work for me, and so does Tom. So we know they exist.
Do we need to take action on this today, or just information?
No, this is information. You don't have to take any action at this time.
Carmel, again, I'm not clear on what the procedure is as to how we get from here to there. So we'll have a project manager, and the project manager, so we're talking about a feasibility study. And I guess part of that, so, one of the big discussion items here, and I don't know if this is acceptable to be tacked onto what we're doing now, but we want to look at the different sites and move forward as fast as possible in building these different facilities. The question is what is the progression? You need a project manager in order to get, for example, you need estimates, and before you get estimates, you have to have somebody that contracts with the people who look at the different properties. I mean, maybe you can outline, I think you yourself also said that you'd like to push this in front of the Board of Supervisors as soon as possible, but I would like to know what that involves exactly.
So I think that, the one thing that I think is missing from the conversation is that Measure B, this money and the initiative is a major project. This is not like, just, okay, we're gonna, do something for a month. I mean, this is a major project. And if you look at, I'm gonna use the wing of the jail as an example of all the people that are involved in just building one wing of the jail, right? And if you've done construction or reconstruction in your home, think of all the people that come in and all the people you have involved for something like a $50,000 kitchen. We're talking 30-some million dollars, we're talking 3 services, 1 building, 2 buildings, who knows? You know, under normal circumstances, I think we should hire 3 or 4 people, whether they're contractors or consultants or county staff or what. We're not doing that, we're doing as low budget as we can, even to the point where the sheriff has not charged any of his administrative costs. My office hasn't charged, we're not charging Carla's time. We're trying to keep as much of this money for services, and that's the right thing to do. However, when you ask about time frame, who's gonna do the work, how's this gonna get done, we need one person to start this process. Now, my office can start drafting the RFP with the assistance of the people that we have involved. I think that Mark Myrtle and Ross Liberty actually are very good advisors for us. Donna is there as more of a technical advisor, and then of course our staff. So, but the process in and of itself, once we get that person as our project manager, they will begin to do the process of helping us develop the RFP, release the RFP, get that RFP back, hire consultants that are actually going to do the feasibility study, and then we work with them, we get those reports, we bring them back to the Measure B committee, then the Measure B committee would make a recommendation to the Board of Supervisors based on that information. That would then go to the Board of Supervisors, and lo and behold, we would have a decision.
So what you're saying is, at this point, until we have a project manager, there's really nothing much we can do.
No, I'm not saying that, because we have done, one is we do have county staff right now, whether it is the sheriff's staff or my staff, that have been working on Measure B. I mean, this meeting didn't just happen, right? I mean, everything we've done for the past 14 months has been done. We have people working on this. What we don't have is people who are dedicated to either the feasibility study, building the building, looking at Howard, looking at Doris Street, looking at Orchard. That we don't have, and that we need. And so we will have.
So that's something that you're doing or that we should be doing?
As staff, I am directed by the board to get it done, and so that's what we are doing. However, again, we have, Mark Myrtle has volunteered, Ross Liberty has volunteered, Donna has volunteered. And so we have people from the committee that are advising us on some of the best course of action.
But again, I guess my question is, then, is there anything that this committee can do?
Well, I think something that was brought up by Mark when we were, by Member Myrtle, when we were talking about the ad hoc was, I think you brought it up, somebody brought it up about, maybe actually assisting with this process by looking at the different locations. My goal is, as we develop the RFP, is to have it reviewed. We're not going to just develop this RFP and put it out. So, it's quite possible that members of the committee would actually like to take a look at the various locations. So this committee will certainly be advisory to this process and ultimately a decision maker as to what goes to the board, what the final recommendation is to the board. But between now and then, I don't see a lot that this committee can do.
Okay.
Unless I'm missing something, I'm certainly open to suggestions.
Do you have your?
I do.
Yeah, go ahead.
Question, Carl. One of the concerns that we talked about was it would be hard to find a person that could do this, and it sounds like, as you said, there are people that can do this, and you mentioned, your staff, my staff. And for those of us that feel a desire to move ahead, can you give us a time frame of when's the soonest a person like this might be on board, and what's the latest so we can?
So if we could just go ahead and hire, we could have someone in this position, within a week or so. But if we want to do a competitive process, an open and transparent process, it will take longer. And right now, we are slated to do a competitive process. So this position will be posted until April 9th. providing we get applications and applications with qualified applicants, then we will begin an interview process. And so if this closes on April 9th, 2 weeks later, around April 23rd, we should be able to, we'll have a list and we should be able to start interviews. So we should be interviewing in May and somebody should be on board in June. Now, with all of that said, as I had mentioned before, we do have people with qualifications to be project managers within our county system. My goal is to utilize one of my analysts to begin looking at project management software and to assist us in doing some of the things that need to be done until that project manager is hired. And that is the only way. I mean, we can sit back and wait another 2 months, or we could, again, reassign another staff person to do some of this work. And that is my goal, unless this committee decides that's not a good idea. I'm open.
This would maybe not be a good idea, then, Clay.
Well, you know, we're looking at project management software. That should be probably around $35,000. I would say that that would be a Measure B expense. That will have to be approved by this committee. Certainly, we're not charging any staff time. The sheriff didn't charge any staff time for his staff. I'm not charging any for mine. But there may be some expenses that we will incur before our permanent project manager comes on board.
So another question related, is it possible to keep moving ahead with the priority programs we've agreed on and get RFPs sent out soon before the project manager's on board, which could be, I mean.
It depends on how much we can get done. You know, I mean, it's, somebody has to actually draft the RFP.
I get that.
And so right now, it is the county staff that already are, you know, already have various activities that they're doing. So, yes, it's possible. I don't know how far we'll get. You know, my hope is we can have an RFP drafted in 30 days, but my guess is this committee will want to review, unless you're going to say no. But if this committee wants to review that, that will create a delay. If I could just use the advisors that I've been using, that could move us along a little quicker. So I hope I'm answering your question.
Well, it is, I mean.
The sheriff's holding his head, I'm not sure what that.
No.
I mean, my hope would be that, one, you could facilitate and move it ahead. And number two, I trust you and the advisors from our committee to make a decision about that without having to take a month to meet the next meeting and to get them out there. And then when a project manager comes on board in May or June, we would be just that far ahead, and I think that would be worth doing. And I trust you to and you all on the committee that are advising to move that ahead.
Thank you. Believe me, we really want to get this done.
I get it.
We want to get it done right, but we would like to get it done quickly.
I have a question.
Yes, sir.
So I'm reading here that it'll be a single incumbent classification assigned to the executive office.
You had to put something in there. Where do you want it?
Well, is that going to be an office or a desk in your area?
Right now, I don't know.
Okay.
I mean, you know, right now, I mean, it's, I don't have a lot of room in my office. You know, you have to list where the workspace is going to be.
And, but it'll be paid by Measure B. Right?
This person is 100% Measure B, 100%. Measure B should pay for this. Measure B is not paying for anybody else's time right now. I don't think, is Measure B paying for anybody's time?
No.
No, thank you.
So 40 hours a week, the project manager is going to be
Probably more than that. but
jump starting
40
this,
hours.
okay, all right. We need it.
Thanks.
Any other discussion? Any public comment? Is that item? Moving on to item 3G. So discussion and possible action including amendment of the master meeting calendar, changing meeting rotation to bi-monthly. So I don't know if we're there yet. I think it's worthy of a discussion, but as we can see, there are going to be a lot of delays in actually being able to move forward on any particular item until we get the adequate staff. This may not be the time to change from monthly to bi-monthly, but I think that there's going to come a time. I mean, I think that what we're undertaking now is straightforward, but again, I don't know that I understand what all the procedures are. Just that to be reassured that it's going as fast as it can, and there's not much we can do until we have the staff on board to know what we need to know. Initially I was thinking it would be very nice to push forward with the Orchard Street property as was already planned. But I guess if we're going to consider possibly that as a site for the PUF as well, it's difficult to do until we can get bids and estimates. So that doesn't give us a lot to do until we have consultants on board. Go ahead.
Dr. Barish, this is a great idea, really and truly. I mean, we don't need to meet for the sake of having meetings.
Right.
I'd like to ask, and wording on the ad hoc that we approved. It's the need for the building, the brick and mortar response that we talked about is going to be critical to what we need. Do you think that the report, the ad hoc committee could meet and have something in 4 weeks, or do you think 8 weeks? The suggested calendar that you put in here certainly starts next month, in April, which is fine with me, but I agree we don't need to meet for the sake of just saying we have a meeting. We need to have something productive to discuss and to move forward. And so if we're looking at what Carmel's talked about, the project manager, and we're looking about the other decision we made regarding the ad hoc, is May the appropriate time, or are we going to meet in April for the purpose of talking about what's going to happen in May? Thank you.
Any other comments? Yes.
Yeah, we've met 15 times now. I don't see that we've created a lot of movement. Meeting bi-monthly is gonna slow that process.
There.
So I don't know that we're doing due diligence. I would like to think that we review this after we have clear direction, but I don't know that meeting bi-monthly is gonna move this process quicker. It's my personal opinion.
Well, again, this is what I would like to be clear about. As we've talked about, we have 3 priorities. We have 3 buildings that we talked about building. Is there anything more that we can do to make those happen faster than they're already going to happen? That's the big question. And my understanding, at least, was that, certainly we can have discussions about the different locations, but there are enough questions about each one that I think we need more information.
Well, let's talk about it.
Yeah.
So,
Well,
if we don't meet next month, what's gonna be what's the progress between now and May?
Well, again, we have to, part of, and this is what I was talking about as procedural, what is step 1 and step 2 and step 3, and my understanding is we need to have a feasibility study. We have certain locations that we have in mind. We need to hire a project manager to do a lot of what needs to be done. Project manager is not going to be online until, it depends
Probably
on.
by next meeting at the soonest, right? If it was April.
Well, we're gonna have, let's see, we won't have our designated project manager on in April.
So,
April 9th, the applications come back.
so maybe not meeting until May.
That's what
Would
I'm
make
asking.
sense, but doing it bi-monthly from now on?
No, I think we can, I think we can alter the meetings as we want, but I mean, when we're hamstrung by procedure, then I don't see that there's a lot to talk about. But I'm not, you know, I don't necessarily want to know the details about all the procedure, but I would just like to know that we're, I mean, like you, I would like to know that we're moving ahead as fast as we can.
A month comes quick, and you need to work diligently to make that. If you let a month between that happen, then you can let a month slide and
You
then
know what,
work
you're
2 weeks before.
Maybe now's just not the time.
I'm
I
just-
concur, I think we should stay how we are.
We need,
That's fine.
and I'm not saying I would much rather personally do it bi-monthly, but I think to stay on task until we have clear direction, I would vote that we, you know, vote per meeting, if a meeting next month is needed, but I don't know about going bi-monthly.
Again, you know, I was saying that this may not be the time, but I think that it's just something to consider. Unless, yes, Jim?
To me, it's more important to me that we have clear guidance of what we're going to do at every meeting, that we have a clear direction and we know from meeting to meeting, here's what we're working on, here's why we're coming together. And if that works best every month, great. If we need it at a different time sequence, I'm hoping that one of the major things that a project manager does is to outline exactly what we're going to be doing, what issues are going to be, so we don't come to a meeting as we do now with kind of a wide open agenda that can be here, there, and everywhere. But we know every time we're coming, here's what we're going to do, here's what we prepare for, here's how you're going to use all our skills and expertise to make a decision at every meeting. I'd like to say every meeting that we make a decision that moves our process ahead to the next step. But at every meeting we feel good that we accomplished something and we're on our way to the next step to getting our 3 priorities done and then whatever else we do after that to continue. So that's what I'd like to see at whatever frequency we meet.
I think that's a good comment. And it would be, so I'd be interested, for example, at the next meeting, what do you think would be a good agenda item that might move the process forward faster? I guess that's what I'm talking about.
Just can we, just to clarify, to keep in mind, I solicit agenda items 2 weeks, 2.5 weeks before the meeting. Send the notifications out, the agendas are published, 5-6 days before the meeting. So when you're thinking about the timeline, we're almost preparing the next meeting in 2 weeks. So that's something to think about. If you think in 2 weeks, we're going to have solid agenda items to bring forward to the next meeting, we just have to keep in mind that as far as like preparing the agenda and the Brown Act requirements, we have to be prepared in advance.
Yes?
Sure, I'm thinking that what we could do is, we can amend the master calendar, or we can just say we're going to go dark in April, we'll be back in May, and then in May determine if June works or July, and just keep it open. We can certainly we can say in May that we're not going to meet in June, make it public, put out a press release or whatever. and just
You
do
can
it
do
that way.
basically what we want to do.
Yeah,
Yes,
so we skip April and go to May.
well, that's not what I heard. Was that?
Yeah,
Oh.
May's not productive. I mean, April's not productive.
Right, yeah. So, shall we take a vote then, a motion to skip May?
The next,
Skip
the
April.
next meeting would be May, the next
And
meeting
next
that
meeting
we
in May.
would be May. Good, sure?
Yeah, that's fine. I'm just hoping the ad hoc committee is going to actually be meeting during this 8-week period. So in May, probably the focus agenda item would be the report from the ad hoc committee.
Yeah, that would be
Okay.
better for me, I mean, instead of
Okay.
So would you like to make a motion?
Well, we need public comment yet?
Public comment, anybody like to comment?
I just have a question. If you're looking for a project manager, you're gonna wait till May to say if you found somebody? Because you couldn't do it without having a meeting because of the Brown Act.
Found somebody.
We don't have to approve it, do we?
No.
No, it's just county procedure.
That was my question.
Okay.
So do you want a motion?
Yes, please.
Yeah, that's right. Yeah, go ahead.
So you're gonna make me do it?
Yes, you.
I move that we go dark in April and meet again as scheduled in May.
That's
All in favor?
Aye.
Any opposed? Passes.
Report out.
Yeah, before we continue, can I just remind everyone that if you have anything that you'd like to be included on the agenda, please send me an email, let me know what you'd like to have included on the agenda. I solicit them every month. Any agenda items that are submitted, get on the agenda. Thank you.
Yes, before I move to close report out, I have a question for Carmel regarding, is there something on the table that Kemper Kemper Consulting Group is still owed money?
No.
Oh, it's not, okay.
It was just an example.
Okay.
You gave an example earlier.
Yeah, you
Okay.
said, remember, there was 28,000 and I brought it to the board and they would not approve it unless Commissioner.
Okay, but it's all taken care of.
Yeah.
It's all
She was
done.
just telling us how much power.
Yeah,
Okay.
that's right. Thank you,
You're
Chair.
welcome. All right, shall we report out on activities regarding items of general interest, activities regarding mental health? Janine, would you like to start?
Sure. So I think Carl will talk a little bit about this, but in case he doesn't, we have our next crisis intervention training coming up, April 3rd, 4th, and 5th. So hopefully everyone's signed up who wants to attend that. The other thing, just two things, is we won't be meeting till May. April, we celebrate alcohol. We bring alcohol awareness to our community. So we do red ribbons, and we'll be out in the community talking about recovery that impacts mental health, because we have a lot of clients that are co-occurring. And then May is Mental Health Month. So we'll be doing a lot of outreach and events in May to recognize May as Mental Health Month, and also Stepping Up.
You want to talk about stepping up? The public meeting. You can tell me. All right. I'll do it. I've been going to the COBLA, to their innovation plan meetings. And it's very interesting and beautiful. The Stepping Up initiative is planning to have public meeting in May for Mental Health Month and having some guest speakers that are nationally known to educate the community on what it is. And you can better explain that.
I don't have a report.
Lloyd?
I don't have a report.
I have been involved in this outpatient case management that it looks like Adventist Health will support, which will have some overlap with it. So it'll be a health outreach to try and keep high utilizers from using services, not only hospital, but also law enforcement, ambulance, and other services. We're trying to satisfy what they need without having them having to come to institutions. But more to come.
Just, we met with Carmel, Masketti, interviewing potential project manager, which if we could get this person, I think would be very beneficial for us. Getting contact from the coast concerning the lack of mental health services being planned by this board. So they're not very happy about that.
I'll be reading this after from.
Well, they're reading it from the papers, and what people are talking about. And, you know, and I've had the stakeholders meeting, and from what I see we can afford and moving forward, that we can't have mobile crisis stabilization facilities all over the county. And but that's my report.
I toured Old Howard Hospital again with Arnie Mello 2 weeks ago with the intention of looking at it specifically to see if it could be transformed into transformed into a training center. I think it's a very viable location for a possible training center, and I'm looking forward to discussing that further. As coroner, Mendocino County continues to be 11th per capita in the state for suicide, and so I appreciate the mission that we're all in, that we're all doing. We should be 58th in the state of 58, lived in the most beautiful county in the state of suicide, but we're hanging in at number 11. That's it. Thank you.
Nothing new from me.
Let's see. This was the communications. There's a email from John Wetzler. And he says, I know that there is a meeting today for Measure B. I had intended to come over the hill, but this morning's weather doesn't look too good. I was in Ukiah yesterday. Will I be able to watch the proceedings on YouTube? I was in touch yesterday with Nevada County's fully operational crisis stabilization unit. I asked about what its addition to the welfare of the county's mental health care system has been. I received an all very positive response regarding patient care, more than paying for itself by lowering the out-of-county placement for those 5154s. And they are now able to care for voluntary and involuntary patients for up to 72 hours and have worked with additional lengths of stay given their bed space. As a coastal resident for 45 years, it is clear to me that some form of enhanced care for the coast must become a part of the Measure B discussion. We have to be able to write 5150s and care for their safety as well as the safety of our community. You are the District 5, this was to Ross Liberty, representative on the committee, and your voice should be loud and clear for the 29,000 people living on the coast having to rely on a 60-mile plus drive by themselves or in a sheriff's car to access fully professional mental health care. The 4th and 5th districts must have good size cut of the pie. My take is that the Mendocino County Behavioral Health Board will accept nothing less. John Wetzler. Is there any further public comment? Well, then I think we're at the end. We can adjourn.
Thank you.
Yes. So